I'm John Brumstead. I'm the Chief Quality Officer at Fletcher Allen Health Care, and I'm also a practicing physician here in Chittenden County. And we're talking today about the impact of the electronic health record, which we call PRISM. It already has had an impact on the quality of care and the safety of the care delivered here at Fletcher Allen. For instance, all of the medications that are ordered when you or a loved one are on one of the hospital units, if you're here getting your care, are put in through the computerized system so that there's an automatic check that you won't be getting a medication that you're allergic to, or that there won't be any adverse interactions between the various medications that different doctors might have ordered for you. So that's a real live example of right up front using the technology to improve the quality and safety of the care.
Patient care has improved dramatically with PRISM. We have immediate access to patient information that we need regarding any reports that are written, any notes that are in there, our labs, our x-rays. And at the bedside we have so much computer equipment. We have a wall-mounted computer for each patient on our unit. And we also have our WOWs, our workstation on wheels, in which the nurses can do their assessment, do all their documentation, entry right there at the bedside, and do data retrieval. They can look at what their patient labs are, what their x-rays are, any information that they need to complete their assessment and make their plan of care is readily available to them. As far as medication administration, we are doing barcode scanning here on the unit, in which we scan the patient bracelet and their medication administration record will open up. We can scan our meds, make sure we have the correct med, right patient, right med, right dosage. If there is something that's not off, if we scan the med, we'll get an alert.
It also improves efficiency dramatically because it brings to any clinician who's involved in your care at any time, they can see all of the other information that the other clinicians have put into the record that are related to your care. And this includes various tests and whatnot that other clinicians may have ordered.
The reason why I feel that it's important is that if you think about the paper chart and paper in general, it can really only be in one place at one time. So that if you're a patient, at Fletcher Allen, you come through the ED, you become an inpatient, paper is created on you as you go through that care process, and then you end up back at your primary care provider for a follow-up visit. Hopefully that primary care provider has gotten all the information that happened to you at Fletcher Allen Health Care or any other hospital facility for that matter, but a lot of cases they haven't. So the interaction with you, and I'm sure you've experienced it, can be where the provider comes in to meet with you and in some cases doesn't even know that you were in the ED the week before or were an inpatient, and you kind of start from ground zero with a question and answering of, so what were you in for, what did they do, what's the medications that you're on. Hopefully that's not, even in a paper world, not the case all the time, but I know it does happen. It's happened to me in the past as well. Now with the electronic health record, that interaction is very different, because now your primary care physician can actually see all the information that happened to you when you were in ED.
We're actually extending it out to the doctor's offices that are part of our system, and that started in November with our practice in South Burlington, the Escalapius practice, and through March we're going to roll it out to all of our primary care offices, and then through March to August we'll have it in all of the specialty practices.
I'll sit down with the patient, review on the electronic format the reason for their visit, their vital signs, their medication lists, their medical history. I can review very easily any visits that they might have had with specialty providers. I can also look for any med changes that might have occurred since our last visit. I can review ER admissions, I can review x-rays, I can review labs, all of which are easily found with a few clicks of a mouse. I'll see the patient. We have a discussion regarding what the issue is. I then examine the patient and then do any ordering of labs, x-rays, referrals, all through the computer so that it is there and saves the need for so many paper referrals, which is what we had done prior to PRISM. At the end of the visit, based on what I diagnosed the patient with, I'm able to give them a after-visit summary, which talks about the reason for their visit, their vital signs, any orders or tests that we might have done, and what their diagnosis is. Along with this after-visit summary, I can give them information that is taken from a website that is embedded in PRISM, and this website is called HealthWise. And from this, I can search and get information on diseases or diagnoses that I have made on the patient, and I can give them as a resource to the patient. And it is written at a level that is easily understood and very patient-friendly.
I think from a patient perspective, patient satisfaction and the quality of that encounter is much greater than in the paper world. And I think for the provider, they feel they're much more efficient in caring for their patients going forward. I think our next step is what we're looking at is really bringing the patient even closer to the chart and providing them with some tools that we'll be rolling out next year, a window into the electronic health record for them.
We're moving to an electronic environment. The ability to maintain security around that information is still at the top of our list of important items to tackle, and it turns out that it actually is more straightforward and easier to maintain security of those records in an electronic environment than in a paper environment. We're able to secure your health information in such a way that only very specific individuals who have a need to see your information from the perspective of delivering health care to you or making sure that your insurance company is in the loop. We're able to do that in the PRISM environment with a great degree of security. So we're paying attention to that, and it's very, very important to us to make sure that that's one of the improvements that we bring when we put in the electronic record.